Welcome. This is the Self Careapist Therapist podcast, and I'm host Lorraine Moorhead, therapist and clinical social worker. In this new season kickoff episode, Regulate, Relate, and Reason, a deep dive into the Neurosequential Model, we discuss an approach to how the brain and problem solving is impacted by childhood trauma. This model was developed by Dr. Bruce Perry to integrate core principles of neurodevelopment into practice. Dr. Perry wrote the books The Boy Who Was Raised as a Dog, Born for Love, and What Happened to You, which he co-authored with Oprah. Coming from the Neurosequential Network today is Michelle Maikoetter, who's the Director of Special Projects and plays a leadership role in organizing, managing, and facilitating collaboration across programs. She's been studying this model herself and integrating it for over 15 years, while for over 30 years, she's worked with youth and families in various settings, and the majority of her roles have been administrative. She feels the strongest connection serving in residential education settings and is passionate about ensuring leadership and programmatic systems are aligned. Be sure to stay till the end and head to lorrainemoorhead.com/podcast to grab the personal curriculum I've developed or CEUs that may accompany the episode. Welcome to the Self Careapist podcast, Michelle Maikoetter.
Thank you. I'm happy to be here. I'm happy to see you.
I'm happy to see you too. Can you start just by telling me how you got started with the neurosequential model?
Wow. Yeah, that was a long time ago. It's been quite the journey. Let's see, back in 2009, I read an article in a journal, and it was called The Neurosequential Model Therapeutics. And I read every other article except that one because I didn't understand the title. And so I skipped it all, and then I came back and I wanted to finish the entire journal, so I went back and I read it. And when I did, I thought, this is amazing. And I took it to my boss at that time. He was the vice president of the organization that I worked for. And I said, you got to read this article. I said, I can't even explain to you how much it encourages me for the work that I do. I've always worked with children and families at risk in residential and other facilities. So he read it and we were both mesmerized. And at that time, Dr. Perry was just starting to formalize. He'll say it was a little bit more formal than what it actually was when we first got introduced to it. But we contacted the organization at that time, which was Child Trauma Academy. And we asked to join in. And at that time, you could just get on a call with Bruce and he would staff clients and they would give you kind of a preview of what it would be like. And he would do psychoeducation as he staffed clients. And that was how you got introduced to his model. So we did that for about 6 months. And then we were so intrigued, we decided to go ahead and join to receive formal training. And at that time, I was over an organization in Texas and we became formally trained by 2012. And then I became one of his first Child Trauma Academy mentors. And then that name was later changed to the Neurosequential Network. And then over the last 4 years, after he wrote his book with Oprah, he got a little bit busier. And so he asked me to do some contract work with him. And so now I train other individuals and organizations in his model and then other people as requested. So it's been a long journey, much more formalized now, much more in depth than what it was then. But I'm so privileged to have been a part of that very early beginning of the model and see how it's evolved over time.
Yeah, it's a great story. You tell it in such a funny way because I think that where we need to start is exactly what held you up when you avoided that first article with what is the neurosequential model, because it sounds a high level, it sounds like, and it in some ways it is because we're talking about the brain, but I think that is probably a common response because it sounds like something beyond what we can access, I guess.
Yes. And I remember talking to him about that. He said, I did that on purpose because I wanted people, if they weren't really interested, to not bother. So it kind of did its job, right? That was neurosequential was the term that he made up. And he said, I only wanted people that were really motivated to learn something different to be intrigued by it. And so I think it definitely did that. And then just looking at how it has shifted. I know people think it's a training a lot of times, but I always talk about it's really transformational for every aspect of your life. It's the lens that you use to understand yourself, to understand the people that you love, not just the people that you're trying to help, but the people in your own lives. And then the way it kind of gives us a shared humanity and some shared grace to understand why things are so hard sometimes when we don't think they need to be.
Yeah. How does it, so going back, what are the core tenets of it now for someone who's starting to learn about it?
So the basic idea is that understanding that how our brain develops depends on our experiences and our history, especially those related to our caregiving experiences early on.
Yeah.
So we know that the brain develops sequentially, which is why it's called the Neurosequential Model, and that there is such dynamic development and that in utero to 3 years of an age, that anything that happens during that time has a disproportionate impact on the way the brain develops and organizes. And, we used to kind of think the exact opposite, that whatever happened to you in those early years, you didn't have language for or a memory of, and so it didn't really impact you. And now what we know is anything that occurs during those formative years, really developmentally sensitive time periods, has this huge impact on how the foundational neural pathways are laid down that have to do with your ability to be regulated, the ability to build relationships, the ability to control your impulses, the ability to think about cause and effect and abstractly, and that all those things are being laid down early on, so that anything that does not happen that should happen, or anything that happens that is adverse as opposed to positive, can impact functioning, have a cascading effect long term, not just within that time period. And so it really does shift kind of the traditional perspective of how things that happened early on really shouldn't be impacting you now. And I remember having those conversations with staff and parents about how you can't tell me what happened to her at 2 is impacting her now at 13. And that's exactly what we understand, is that this creating those neural systems, these sensitive stress response systems really impacts all of our capabilities throughout our lifetime.
Yeah, it makes so much sense to hear you say that, because I think that's something that all of us who have worked with kids and families have noticed or argued at some point, that this might not be evidence of something happening right now. This could have been something that happened that you wouldn't even think they would remember, in the orphanage in their first year of life, in some of those relationships that they were building or not building in their first year of life. So I think that's such an important reminder.
Yes, absolutely.
And how does the assessment portion of this model maybe differ from a standard DSM type of assessment and diagnosis?
Yeah, so it really is. I think a lot of us are used to looking for kind of traditionally looking for what are the problems, what are calling the biggest challenges currently in their functioning. And although we do look at those things, the biggest thing we do is take a history from in utero to present, and we look at not only adversity, but also relational health. So how does relational health buffer or was not able to buffer that adversity? Because we know you can handle a lot of stress if you have high relational supports. But we also know that for most of the families and the children that we work with, it's the opposite, where they had high adversity and low relational supports. And so we take that into account for how the brain develops, and we create a representation of a more atypical brain as opposed to this individual's brain and their experiences, especially with caregivers. And we look at all of that to see how to sequence our interventions based on that development, so that we can start in a place that's going to be most effective and then build from there in a sequenced way, instead of kind of giving the same interventions to anyone for any type of history. We do it in a sequential way that better ensures success for the clinician and for the client. And then we also look at just their therapeutic web, what we call a therapeutic web. So who's within their environments already, schools, faith, all these kind of other areas, not just the clinician, not just the caregivers, but then how do we build relational supports within their entire community to help strengthen the impact of what we're trying to do.
Yeah. So when we're talking about the sequential organization of the brain, Is another term for that bottom up, or is it similar to that type of process?
Yeah. So we often talk about the brain develops from the bottom to the top and from the inside out. So kind of from those most primitive, temperature, metabolism, heart rate, blood pressure, all those kind of things that you need to have to be alive. Those things develop first. That's kind of your foundational base. And then as you grow, as you're born and you progress, then those different areas of the brain also grow and progress. And that final cortex, how we think of the brain mostly is the cortex with language and having a sense of time and cause and effect, that doesn't fully develop what you know now until the mid-20s or early 30s. And so it is sequenced in that way. And we often think of children as being fully developed as soon as they came out, like they're already should be able to do some of the things that we could do as adults. And it's just not developmentally aware or sensitive to the fact that the brain does develop in a sequence and takes a while to be organized. And when you don't have the right type of experiences or relationships to organize it the way you want it to, there's going to be some things that are going to be challenges that we have to work on.
Yeah. Is it possible to give, so you just said that obviously there's not a standard treatment plan, and so I don't want to sound like I'm inviting a conversation like that, but is it possible for you to describe what might be some of the, like a type of goal given given what's ascertained during that really in-depth early assessment?
Yeah. So, I think one of the confusing aspects is we all know that trauma-focused CBT is one of the, best evidence-based therapies for people that have experienced trauma. And so a lot of times when we see someone with a history of trauma, we'll say that's what they need to have, right? That's what evidence shows us. And what we know is that for a lot of the individuals that we work for, they're not yet ready for something that's quite that cognitive, that's quite that language oriented, because we know that all these systems that we're talking about, they're all integrated, but there's a lot of lower systems that have to do with bodily sensations, with emotion, with relational capacity. And so those things have to be, integrated and regulated in a way that you can access those cognitive capabilities. And so we might start some lower things, so lower brain, bottom up activities like sensory activities. A lot of our kids, maybe who did not get as much sensory input, like being held and rocked, and those needs met early on, have a lot of sensory issues that they might need to be addressed first so that their system can be soothed and calmed so they can get to the language aspect. And so it's not that, I think sometimes there's a confusion that we don't recommend certain therapies. It's not, and that's not the case. It's just that we often recommend a sequence of the interventions to the point where a client's ready for them, that they're going to be the most effective for them.
Yeah. Yeah. And I think I've actually heard to the contrary that I think there are a lot of therapies, or several at least, that in some ways complement. But I'm thinking right now, I have an EMDR lens myself. And even with adults, what you said is so important because there is a cognitive piece that we want connection with. And that in some ways, that's just not online sometimes. It's not a concept of aptitude because we could be dealing with really cognitively, really smart people, but it's just when we're touching that trauma, that cognitive awareness can be totally offline.
Yes, absolutely. Same way, and I love EMDR too, but it's the same way that there's times when that is not appropriate yet, right? Doesn't mean it won't ever be appropriate, just means at this time that client might not be ready until they can be able to, a lot of our clients dissociate or they emotionally separate themselves from whatever's going on, and we need them to be able to be present when we're trying to do some of these therapies with them. So there might be other things we have to help them with to get to the point to tolerate the EMDR so that it is effective. And then, just like everything else, EMDR is so powerful when there's single incident trauma, but then when it's developmental complex trauma, it's all it's all a little bit more complicated. It's all a little bit more mixed together. And so it takes a little bit more separating some things or working on some things in that sequence to be able to make that an effective intervention.
Yeah. I think that's a really great perspective. So it sounds like we've kind of brushed on the 3 R's at this point. And I'm hoping that we can kind of go back and talk about each one.
Yeah. So just like you were talking about from the bottom up, so we talk about the sequence of how the brain develops. So it's from the bottom to the top, and so when we talk about the 3 Rs, we're talking about that same biological understanding that we process information from the bottom to the top. And so we talk about regulating yourself first. And so that would be that lowest, most primitive level of the brain to be soothed and calmed. And then to relate, so that would kind of be in that next midbrain area that has to do with relational capacity. And then for reason would be that cortex. And so if we're able to be regulated ourselves so that we can help the other person that we're talking to be regulated, then we're able to access our relational capacity. And then we're able to actually use language and cognition and cause and effect and think about consequences and abstract thinking. And so if we do that in a biologically respectful way, we can have very good conversations where we learn things about each other and we have insight. But often what we do is we try to talk to someone either when we're dysregulated and we aren't exactly able to fully access our cortex, and we're not able to be fully relationally engaged, and we aren't able to get to the actual point that we're wanting to get to. And so we talk a lot about it depends on us being regulated first before we can regulate someone else, before we can be relational, and before we can reason with one another and get to, wanting to understand consequences or wanting to understand what actually happened or should have happened and that kind of thing. And so it really is, I think that's the other big piece of this, is that we often think we're learning what to do for somebody else. And it's often more about what we need to do for ourselves to be able to help people the way that we want to help them. And so we talk about regulate, relate, reason, and because we are trying to be respectful of that biological process of how the brain processes information from the bottom to the top.
Yeah, I think that is so important. I was just thinking, I want to go a little more into each one, but I was just thinking with that, I hadn't really considered this before, but with that reason thing, that dang reason thing, that's probably our instinct oftentimes with kids that come in and they're doing this or that at school, and the parents saying, hey, they need help with this, and the school saying, hey, they can't be doing this. We often try to go right in and talk to that reason part. Yes. And we're like, hey, do this instead. Why don't you try this? And that it's like, they might even do it, but have we really responded to, they might be able to mimic or parrot what we've taught on a reason level, but have we really done anything with why that behavior exists?
Yeah. I think too, when you don't really understand why we're suggesting that or why we're recommending that, if you're just saying it's 3 steps, right? It's 3 steps instead of like, here's the biological processing of why that's important. And then I think the other piece is, we understand like when we've made mistakes, when we've said something we didn't want to say, or when we acted badly and we wish we wouldn't have, we usually understand what was going on with us. But when someone else behaves badly, we often default to they did it on purpose, they had control, and they did it, intentionally. Whereas this helps us understand it's all of us. We all have when we get overly stressed or overly tired or overwhelmed or, something evocative gets us too stressed, then we make bad decisions because we're not able to access that cortex as much as we want to. So we're more reactive, less intentional than we want to be. And so I do think it's so important to understand that about all of us, not just, the kids are the ones that we think are having the difficulty, but that impacts all of us. And then, just like what your podcast is about, if I can't take care of myself in a way that I can be baseline regulated most of the time, not all the time, but most of the time, so that then I can actually be regulated for someone else, so that these things can be relational, so that we can learn with one another and be able to access that cortex. Because we always talk about the cortex being closed. When you start getting stressed or overwhelmed, the brain starts shutting down from the top to the bottom because you need less access to language. You need to be more reactive, more behavioral. And so we are primed to behave first, then feel, then think. And we're always wanting everyone to think first. And that's a really hard thing to override those biological processes. Yeah. And so really understanding why that is and why we need to go through the steps. Because I think that's the other thing is we think of everyone as just being a cortex all the time. I think when we talk about kids, we always think it's totally just cortexes walking around instead of realizing it's all these other things that have to be integrated and work together. And so when you understand that, then you understand why I have to go through this sequence instead of just going straight to trying to, threaten a consequence, or you need to think about this or whatever. Yeah. Yeah, because it doesn't work. We know it doesn't work when we're upset or we're overwhelmed, and yet that's what we go to as our kind of first trying to get something under control.
Yeah, you're right. Most adults would say that's the worst thing you can say to me is like start to offer a consequence or try to reason when I'm just upset.
Yeah.
Yet that's
Yeah.
how we
Yeah.
respond to
Yeah.
others. Um, okay, so is that when someone is learning the model, it sounds like there is a really experiential, like when you're going to a training or when you're becoming informed through the network, it sounds like there must be an experiential piece where you're really looking internally and saying, okay, where does my regulation start and end?
Yeah, I do. I think it's sometimes surprising. People come into it and they are used to kind of remembering something or learning something and checking some boxes. And then when you start learning about this, about how all of our brains work, all of our brains, develop, process, all those kind of things, and you start realizing for yourself, you start reflecting and just kind of excavating your own experiences, your own history of relationships, how you were parented, how maybe you've parented your own kids, all those kind of things, not just the kids that you're trying to help or the kids that you work with and families that you work with. And so I do think if people are in a space that they're able to, there's a lot of self exploration that comes along with it. And it really does transform really at every level. I mean, I think about even with the work that I did with the organization that I worked with, we did not take into account how it would change how we all parented our own kids, right? When we started it, it was
Sure.
just about the kids and families we were trying to work with. And at the end of it, we were like, this has changed how I take care of my grandkids. This has changed how I take care of my own children. This has changed everything. And so we really created this healing community because we were on our own campus. It was a residential campus and everyone was involved in the training. And so it wasn't something that was so compartmentalized that it was just an intervention or it was just for the people that we worked with. It was all of us going through that transformation if you're in a place to be able to do that. I mean, obviously there's times when you're just not able to do that kind of exploration and that's okay. But if you're in a place to do that, it really does transform every aspect of how you view humanity in general.
Yeah. What are so as you mentioned, we talk a lot about so actually going back, I had an episode, I don't know if you know her, with Dr. Elizabeth Mackingvale. She is a OCD expert, and she mentioned that when I asked her my standard question about self-care, she mentioned Dr. Perry's work, and she mentioned just some of the regulation research that he's done in terms of guiding her own. She said that one of the, and so that got me curious.
Yeah.
So from your perspective, so just to use her, what she mentioned was that regulation can take 2 minutes. But what are some of the important pieces of regulation? Because I ask everybody this, like, what do you find yourself leaning on when it comes to regulation? What do you think are some of the most important pieces to know about regulation as you're thinking about yourself and also all of the lives that you impact with this model?
Yeah, I think that's a great question. I think I've learned a lot. I think we all did, whether we wanted to or not during COVID.
Yeah.
When we didn't have our relational supports available to us the way that we typically, I really started to understand some things differently than I'd ever understood them before, right? So many things that I kind of took for granted about being in an office place where if I just walked down the hall, I said hello to someone, I got some water, we had a little chat, those kind of things. Well, then during COVID, it was just me and one other coworker in the whole building, but we weren't allowed to be in the same space. So even then we worked together. And so pretty soon, we all began to feel that disconnection and that just like we were just kind of in an uncentered space, right? I just felt like we were kind of in this gray zone for a really long time. And I was pretty lucky that I started out in a pretty resourced way to begin with.
Yeah.
But through that, I realized how intentional I had to be with my relational contacts, that there's a lot of things that was just something it was available to me because of the space I was in. And then once it wasn't, I realized how much I need to ensure that I'm making contact with people that are important to me. And so one of the things that keeps me regulated is when I get up first thing in the morning, I either do videos or little text or whatever to the people that I care about, just to stay in contact with them. But if I don't, I kind of worry about it throughout the day. Like I wonder how my friend's doing, or I haven't checked on my mom. And there's just some things I do just for me to feel those relational regulatory activities. And then the other thing is, I think we had this idea that you when you're upset or when you're stressed, that's when you need to do something regulating. And it's not that you don't, but obviously what we're trying to do is create a more balanced system. And so those things have to be in place all the time and for my baseline arousal to be in a more balanced system so I'm not overly reactive. So all the things that we talk about, right? All the things about getting sleep and being intentional with your relationships and finding some humor and exercising and eating healthy, all those kind of things that we talk about. The reason why these things are so important is to help us maintain, a consistent baseline of arousal that we're not going to be overly reactive to things. Not any one of us, when we get too much stress, it's going to move us along to we're going to be more sensitive to things, easily overwhelmed, less intentional, less thoughtful. I mean, that's just part of life. But that's why all these other things are so important. And then it's not just like the self-care, right? It's the environments that we're in. If the environments that we're in, like your workplace, is an adverse environment where there's misuse of power or people aren't treated well, doesn't matter what kind of self-care you do, it's going to override that environment that you're in. And so it's that same kind of idea. Sometimes I think we think it's a vacation, which vacations are great, but we think it's this one big thing instead of all these little things. And some not so little, right? Your work environment, I think it really opened my eyes to the healing or the harm of working environments, because when I first started, we acted differently than how we wanted the staff to act. So we treated the staff in a more behavior modification way when we wanted them to be more relational. And when we realized that didn't make any sense, that the leadership has to be aligned with whatever model that they're using, then we had to be more relational and we had to be more supportive. And we couldn't treat staff this way and tell them to treat kids this way. And so when that happened, it just opened my eyes to this idea of how workplaces should be places of healing, right? A lot of us need some reparenting. A lot of us need some reparative experiences, and workplaces are beautiful places for that, just like schools can be for children. And so how all of that plays together for our self-care, for our wellness, I think is super important.
I love everything. I love this all. Okay. So, something that really stood out to me was that for you, how you look at it, regulate and relate can really go hand in hand, which I think is so important. I think you'll have to tell me what you think about this, but it feels like one of the challenges of COVID was that the relational aspect was missing for everybody, a lot of us.
Yeah.
And with all that was going on, people weren't necessarily pointing to the relational aspect and saying that's what I'm missing. And so we saw that relational aspect continue to dwindle for a lot of people until now. I feel, like getting people to come to in-person trainings. I don't know if you see this, getting people to attend social things in person, networking events, parties, people. There's still maybe an inclination for a lot of people to opt out of those things because they got used to prioritizing a time management system over the relational aspect, and how they're feeling might be having an impact, but they're not pointing directly to like, oh, when I take a snapshot of a standard month now versus a standard month in 2018, I was doing a lot more social things every day, being in the office, seeing people, attending more stuff, opting in instead of opting out.
I think that's so true. And I think so many boundaries got erased during COVID. Like we're so used to being accessible to someone 24/7 now. Like there's no office hours, there's no home versus office, any of that kind of thing. All those boundaries kind of got erased. And the same thing with social media and our access to our phones. It's like there's no separation anymore. And so I think it's a combination of those things, of us not realizing how important our relational health is, because we're kind of taught this autonomy and independence and doing things yourself, and not appreciating our social neurobiology that says, we are meant to feel safest and the most regulated in the presence of others, if we've had a history that creates that, right? And so we often think we should be able to handle things on our own, or not shouldn't need other people, when really what we know is when we're stressed and overwhelmed is when we need people the most. And so I think that is hard for us as a society, as a people, to understand and appreciate and respect that need for each other, and that when we're able to kind of accept that and be intentional about it. So I would say I was not intentional about it before COVID. And I know several of my good friends, we kind of made pacts that we are going to be intentional about seeing each other at least twice a year in person, those kind of things after COVID, because it just stood out more to us. But I don't think we talk about that enough. And then I think we kind of, we kind of look at if you're like that's a weakness or something that you need help. And I think that has to be, we have to forget all that stuff. And I do think there's been a point where we've kind of all said, we know we're all overwhelmed and overtaxed. And so if you're late or you forget something, I feel like we have a little bit more grace about those things now, or maybe I just do for myself since COVID. I don't know if that's true or not, but it's just kind of like those things are not as big of a deal anymore, and they don't upset me quite as much as they used to. And so I think that was something that maybe was positive. But I just think we're all running, because those lines have been blurred, we're all running so fast and doing so many things and trying to do so much on our own that we're not taking that time to be intentional with relationships that fill us and give us energy and help us keep going to maintain that kind of activity level. And I think it's hard. I think it's hard to do that, and especially when we have so many demands. But I think it's podcasts like this and other educational, aspects that we try to say that that's healthy. It's healthy to have people with you when you need help, when you're having a hard time, all those kind of things, and to give yourself a break that you shouldn't be able to do all those things on your own. No one can do those things on their own, not well, and that's not our biology. We're working against our biology when we're trying to do all those things on our own.
Yeah. So. Going back to what you were saying about the workplace. So what types of things, once you wanted to focus on a more relational atmosphere in the workplace, I was wondering about this in terms of the Neurosequential Network too, and how you guys do this. But once someone makes the point to focus on relational aspects of the workplace, like what shifts did you actively try to make, or what do you think can be helpful to put that into effect?
Yeah. So it's so much the same as what we're trying to do, with kids that we work with. So understanding that when someone makes a mistake, they're doing the best that they can, and something interfered with their ability to do something well, right? And so even with employees, everybody's doing the best they can do on that given day, and what our best looks like on any given day at any given moment shifts, right? I know I have people who tell me I give 110% every single day, but that's not reasonable either, right? Our arousal state, our stress level, all those kind of things, we're going to shift in our capacity of what we're able to do and tolerate and do well. And so it's the same thing with kids and the same things with staff. And so really creating that lens of looking at what happened, that this didn't go the way that we wanted it to go. But of course, that causes, I have to be regulated enough to be curious about that, to be in a space where I'm not reactive, so that I can try to figure out what happened, that this didn't go the way it should have gone. And so creating that kind of predictability and consistency where it's a safe place to make mistakes and to ask for help, just like we want kids to be able to do, is a very intentional and long process of trying to create that kind of culture. Because ultimately, we want kids to come to us when they need help. You want staff to come to you when they need help. You want kids to come to you when they make a mistake. You want staff to come to you when you make a mistake. But if we're reactive and punitive in how we respond, then what we're actually doing is saying, you can't trust me to come to me when you need help. And so we create environments with kids, with staff that tells them not to come to us, to keep things a secret, not tell the truth. Instead of kind of exactly the opposite of what we're wanting to create. And so I think it takes a lot of intention about how we respond. And then it's a lot to ask, but just like we're asking parents to be regulated, leaders have to be regulated. I can't use my power in a disproportionate way when I'm dysregulated to make me feel better. And so those things are hard, to be that mindful and intentional with your interactions, because you're trying to create something bigger, something safe, something consistent and predictable. And so that took a lot of discussions within, my leadership team. We did a lot of, we're going to hash things out in my office. And then once we leave, we're all going to be on the same page. We're all going to respond the same way, because we wanted that consistent, predictable response, no matter who you went to, so that people could come to us when they needed us. Because, everyone in the helping profession comes in with their own baggage. Always about sometimes you've got, the carry-on size, and sometimes you got the 12-piece set. And so we've got to be mindful of those kind of things. And then what do we do to create environments where people can be successful when they want to help others? And it might look like different things, but knowing that we're all coming in with all these experiences and relationships, and that we have to use that same lens with each other and not just with the kids that we're trying to help.
Yeah, it's a great point that it's not just predictability within one person, but it's a concerted effort to have consistency between all of the people that someone may go to, making sure that everyone regards something as important or something as less important, and you're not getting kind of a disorganized message across the support system that you might lean on.
Yeah, absolutely.
What is the relevance of rhythm to the model?
Yeah. So rhythm is just this beautiful thing, right? So we talk about your first rhythms. There's in utero is your biological mother's rhythm. So heart rate and blood pressure and blood flow and all these kind of things. And then the rhythm of the day and the rhythm of sleep. And so there's already rhythm built in while this neuroarchaeology is going on. And so one of the first things we know when a baby's born and we're trying to soothe them is that we'll rock them, we'll sing to them, we'll hum to them. And so rhythm is really intertwined with these systems that are being laid down, with our regulatory systems, with our relational systems, with what we call reward, which is to decrease your stress and to increase pleasure through relationship. All these things are laid down together. And so when you have nice, present, attentive, attuned, responsive caregivers that provide for you in a consistent way, that rhythm is created through the way they meet your needs consistently, through the routine of the day and the interactions. And so rhythm is really something we don't recognize very often, but is so important to everything else that we do. And for most of us, universally, music and rhythm can be very regulating. And it's often something we overlook, especially with some of the most challenging kiddos that I've worked with. That was one of the few things that we could actually, because relationships were not regulating for them, they were not rewarding for them based on their histories. And so rhythm and music were things that we could use that were actually regulating to them. And so really understanding that connection of why we need that, and then why even our interactions with one another is rhythmic. When you have good attunement, when you have presence, there's a nice rhythm within your relationships. And so being mindful of how to incorporate that into our interventions, that might be as simple, and it's not really simple, but routine and structure. So we even talk about when you're not quite able to be relational yet. So for a lot of our kids who've been hurt by adults, they're not able to be in relationship right away. And so it takes a long time to develop some safety and security with them. And so routine and structure is one of the ways that we can provide predictability and consistency before we're able to even establish that relationship. And so even that rhythm is something that is super helpful when other things might not be available to us yet. And so we talk a lot about all those different rhythms, our relational rhythms, the rhythms throughout our day, and then obviously music. How do we incorporate movement and music into those things to help with regulation, to build relationship, to be rewarded in those experiences?
That's neat how it's kind of woven through the tapestry.
Yes.
In a lot of ways, but starting from the beginning of development, there's rhythm.
Yes.
I wish I knew the exact quote I'm thinking of, but I heard somebody describe after going to a Taylor Swift, like to the Eras Tour show, and the feeling of being a part of something really powerful. And I guess I was just visualizing that. I didn't go or anything. I was just seeing someone's reflection on it, but I was just thinking of how being in a concert setting during a really powerful musical moment among your fellow passionate fans, like kind of taps into a lot of these components with music, rhythm, the relational experience of being surrounded by people that are experiencing the same thing that you are.
Yes. No, I think this, and I don't know if you knew this already about me, I am a Swiftie. So the fact that you even brought that up, I just think, and Taylor Swift has such powerful lyrics. She's such a poet. And so I think there's so much about being attuned and feeling seen and understood in her music. And then, there's such an identification with that group that it is a sense of belonging and being understood. And then it's also why we have anthems, right? And why we have, school songs and those it's very unifying for us to sing together, for know the words, the same words, for us to dance together. All those things are very unifying, and create that relational bond that we are a part of the group, right? Feeling a part of the group makes us feel safe, because that's where our safety comes from, is being a part of the bigger group that can protect us. And so obviously the opposite is true when I don't feel like I'm a part of the group, when I'm on the outside of the group. That's dysregulating, and that's fearful for me to be on my own. And so you can see how powerful when you have that many people all singing the same songs, all dancing, all those kind of things, feeling connection to that huge environment, why that would be such a rewarding experience.
Yeah. Yeah. No, I didn't know that about you. I love her too, though. So, it makes a lot of sense. I think there were some other disarming things that were happening for people. Like everyone was coming dressed up. They were exchanging the bracelets. And so they were really establishing a lot of elements that created a community before that the music part even started. But they were all like forming into their own community from this night in this city on this date, exclusive to them, kind of creating a container for themselves, just even from getting to the venue and standing in line, that it feels powerful and relevant. Okay, so can you talk a little bit about your work at Cal Farley's Boys Ranch?
Yeah. So that's the organization I was talking about. I started working there in 2007, and then we started the model in 2009, and they got fully trained by 2012. And it really was, we were kind of in a period at that time around 2010 where we were trying to be more relationally based and less punitive based, but really people didn't know what that meant. And so a lot of times what that looked like was feeling like you couldn't, like there were no rules or no limits. Like I think sometimes people think, well, this means there's no consequences, there's no boundaries, and those kinds was absolutely not what it means, because we all need good boundaries and good limits placed on us, right? And so it was one of those things of trying to find the balance, because we had people that were really good at enforcing rules, but maybe not so good at the relational aspect. And then at some point, we kind of morphed into people that were really good at the relational aspect, but weren't good at enforcing rules and routine and structure. And so pretty quickly, you figure out that all of those things are super important. You need to have high relational health and also high, structure. And so we looked at how to find a balance in all of that. And so just kind of everything we're talking about is so relationally based, trying to define that a little bit more, knowing that most situations are so nuanced and so individualized, and that when you're trying to have an individual approach, it's really hard to say, if someone does this, then you do this, because it really means you have to be curious about what happened that we got here, what happened within your life, what happened within this day, what's different about today than yesterday, all those kind of things. And in order to be curious about that, and not just again with the kids, but with the staff that we worked with, we have to be in a regulated space. When you're dysregulated, you're more fearful, you're more reactive. When you're regulated, you're able to access that curiosity because you're calm, not afraid. You can be curious about things. And so really trying to look at how to create this kind of nuanced, pretty sophisticated, individualized aspect in a group setting that was really large, right? And so it took a lot of trial and error. It took a lot of discussion. It took a lot of overriding a lot of fear, right? I mean, there's so many things that anytime we'd have a big incident happen, there's such a fear response. We would want to be reactive. We would want to be punitive to feel like things were under control. And it took a lot of, again, someone, usually leadership, needing to be regulated enough to be able to pause, take a breath, and really think about what we needed to do to provide the best for the child and for the system and for the facility and those kind of things. And so it was a lot. It took a lot longer than I would have ever expected it to take. I always tell people when they start these models, it's like everybody wants to get this done in 2 years. And, depending on where you're starting, it took us, a good 10 years to feel like what we were saying and what we were doing were aligned, because you can say a lot of things, but to actually be doing it all at the same time is quite a different aspect. And a lot of people think it's just training, and it's not just training, it's modeling, it's coaching, it's culture. And so it takes all of those things to be real intentional about our language, about our rules, about our procedures, about our practices. And so we really had to look at what do we need to stop doing? That was one of the first things, because we do a lot of things, especially in organizations, that are better for us, easier for the adults, but not necessarily better for the kids. And so to be really thoughtful about what do we need to stop doing and what do we need to start doing differently, and then going through those things and how do you work those out. But you have to create an understanding within the staff for them to respond in ways that they understand the relationship is the most important aspect. Obviously, safety is always number one, but relationships, maintaining the relationships, building the relationships is the most important aspect. And that takes a lot of understanding. It takes a lot of regulation. So the system has to be more regulated to be able to manage those things in a nuanced way, in an intentional and thoughtful way.
Yeah, I mean, I think I was just having a conversation like this that okay, so that on the one hand there is safety in the behavior modification program because it's predictable, and when the rules are clear, you know what to expect, and so that is one element that I'm sure you hope to hold on to after some trial and error. And then with the relational aspect, there's a certain degree of warmth and connection that's happening. And I think it's a great point that it didn't happen. You think you can implement a new system with existing people and new people, and that it doesn't happen overnight, especially as you're developing it as you go.
I was just saying, and just like you were saying, usually if there were struggles, then what we would do is increase structure, but we would decrease relational supports. Right. So we'd withdraw. We'd either say you can't be a part of this, or you have to stay out of this, or you can't go do this. When somebody's struggling, you need to increase the structure and then also increase that relational support. And so we just started looking at things differently. So if a kid was struggling, how could we bring them in closer to be with a staff member so they can still participate in the outings or the activities, but in a safe, supported way? And then the same thing with our staff when somebody was struggling, instead of, writing them up or threatening them, or those, not that that doesn't ever happen, but that wasn't our go-to to try to provide support. Was, can we put a more experienced staff with them? Can we retrain them in a certain way? What kind of relational supports do they need to be strengthened to be able to do this better? And so trying to increase those things at the same time, support and structure, instead of usually we withdraw relational supports and then we put more structure in place, and it doesn't quite have the effect that we're looking for.
Yeah, I think you make that sounds exactly what happens. Like when you're ready to join the group, you can come back, but until then. And so did it in an example like that, does it end up being like maybe more of a one-to-one within the group while you're continuing to?
Yeah, because that's the other mistakes that we often make, is that a lot of kids that come into our systems developmentally have not gone through, co-regulation, or starting out external regulation by your caregiver, and then co-regulation through relationship, and then ability to self-regulate. And so a lot of times what we'll do is we'll say, you get in trouble and I'll send you to your room, or we'll put you outside the group and we'll say, go calm down, right?
Yeah.
Instead of understanding that there's a sequence there in that development, and you can't skip any steps in that sequence. And so we may have to go back to external regulator, me calming you down so that you can get to co-regulation, where I can help you help yourself calm down to where you're able to calm yourself down. So we have to go through that sequence. And so we'll put individuals into group settings for anger management, for social skills, for all these things that they need help with, but we'll put them into a group where they haven't developmentally sequenced themselves to a point where they can handle being in a group. And so it's just the same way with, when you start out young and you have one peer parallel, and then eventually you add a few here and there, and then you can be in a group setting, but you can't just go from being individual and then jump into a group and be able to manage that. And we often see that being prescriptive, that you go to a social skills group or an anger management group without understanding, again, being respectful of that development and how it needs to be sequenced in a way that can be helpful.
Yeah, I'm thinking of a specific example, and just imagining how that has happened. I'm hearing another word I'm hearing woven throughout our discussion is empathy, and I know that was the topic of one of Dr. Perry's books. So how do you prioritize empathy, and how do you see it show up in this work?
So I think it's the same. It goes back to, in order for me to have empathy, I have to be in a regulated space. That's a very abstract thought. Not just me we've kind of all heard about mirror neurons, and if I see something, I can experience that same thing as if it's happening to me. But empathy is really about imagining, right? It's really about imagining what it's like to be someone else or to be in someone else's shoes. And so if I'm able to hear someone's story and imagine what that's like if it was me, then that's a pretty high level, sophisticated thought process there. And so in order for me to be able to do that, I have to be in a regulated space to be able to access that capacity. And if you just think about, this at some level, like if you just think about when you're really stressed, where you're only able to think about yourself, right? So I've been so tired and overwhelmed, even when I had a group of kids I was responsible for, that I just wanted to go to bed or I just wanted to eat, and I was beyond my ability to take care about what anybody else needed, right? We've all been to those places. And so a lot of times we want, especially kids, to be more empathic, but without ourselves being empathic towards them. And so I really think understanding that higher order level of being able to put yourself in someone else's place, understand why that might happen. I think anytime we separate ourselves and say, I would never do that, right? Anytime we kind of separate and say, that's a different person than what I am, instead of having an understanding of how any one of us can get to a place where we might do some really dark things given the right or really the wrong circumstances, right, to get us to that point. I think so much of that is the same, again, us being in a regulated space that we're able to appreciate that shared humanity, that shared abilities to get overwhelmed to the point that we are out of capacity to be our best self, and to just keep that in mind when we're trying to help other people, what we're trying to do to create that space where we can be regulated enough and safe enough to create that empathy is a really beautiful thing. I mean, to just be able to understand when mistakes happen, how any one of us could have made that same mistake instead of separating ourselves, because that's a real protective stance, right? I would never do that, or I couldn't do that, or those kind of things is a very protective stance so that I don't have to feel something that might be hard to feel or might be overwhelming to me.
Yeah. I've had so many older adults come to me and say, I've gone this whole time thinking like this could never happen. I could never feel that way. I don't understand people who have panic, who have suicidal ideation, who have this, who have that. And then I experienced it after all these years, and now I get it. Now I understand mental health. And it's just so interesting. I mean, it's interesting to hear from someone at any age, but I feel like I've heard it more this year from people who have gone decades never understanding or thinking, oh, those are a different type of people that experience that. And then going through that illuminating moment where it's like, wow, now I get it all.
Yeah.
Okay. Because I feel like people are going to be really curious and excited. What is the path to I know I'm sure just like all of this work, there's no one path, but what can someone do if they're interested in digging more into this? What does training look like?
Yeah. So, I mean, we have a lot of free online resources. So neurosequential.com is our website, and Dr. Perry he's very generous with his resources. So we have free online videos, we have a book study to go along with What Happened to You. I think What Happened to You is such a powerful book in and of itself. I've had people tell me I've been to therapy my whole life, but that book, helped me more than anything else, just kind of have some forgiveness for myself and to be able to do something. And so I think that is such a beautiful gift to yourself and to other people that you love. That What Happened to You, I think, is beautiful. We have a free online book study to go along with that. I think that's, especially for organizations, I think that can be schools, I think really powerful. And then the actual formalized training. So Bruce started out with the Neurosequential Model in Therapeutics, which is meant for clinicians, so mental health, master's level mental health professionals. And that's what we originally got trained in. We now have a whole variety of trainings for educators, NME. We have NM-SPOR for coaches. We have NMRS, which is reflective supervision. So anyone that provides supervision for other people, it's a beautiful process to help growth and awareness. And then we have NMC, which is for caregivers specifically. So it could be bio parents, could be adoptive parents, could be foster parents. And so there's different levels of formal training depending on what you're interested in. And then we have, like I said, a lot of free online resources as well at our website. And so, but I think the book is a great place to start. And then that book study, I think, can be really impactful.
Oh, neat ideas. Yeah. I feel like there was one more thing I wanted to be sure and ask. Well, is there anything that I haven't asked you about that you think would be important to mention?
I don't think so. I think this is wonderful that you're doing this, because I think this can be one of those topics that can be really oversimplified sometimes and misunderstood, right? And so I think it's been a really holistic discussion about self-care in the middle of all this other thing that we kind of talked about. So, yeah.
Thank you.
Yeah.
Yeah, it's been so fun to have conversations like this. In terms of that initial assessment page or piece, and just as people are kind of conceptualizing their work with a new client, is there anything that you could suggest that someone could take away or attune to today that might help give a more holistic assessment?
Yeah, I think that one, the one thing we talk about, regulate, relate, reason, right? I think being regulated enough, especially when we're faced with something pretty challenging, to take that time to be regulated enough to be relational, and then reflect and reason, right? And so that we can try to, why is this happening? Why did this happen today? Why didn't this happen yesterday? What's going well? What's not going well? And so I think being that regulated space so that you can be relational, so you can be reflective and reasonable, I think that's helpful for everybody. And again, understanding that through a biological process, not just like steps 1, 2, 3, but to understand why that's important and why we have to be in a regulated place for us to be able to get to some of the things that we want to get to.
Yeah, I think that's great. All right. Thank you so much for joining me today,
You
Michelle.
bet. Thank you. Thank you for having me.